And after being subjected for such a long time on wearing masks, and when the guidelines came out recently, most Americans in the country can now be mask-free. And of course, it always comes back to kids that still seem that there's an err on the side of masking when maybe they are in that group that is least prone to significant impacts from it. So what is your feeling on whether that is a good decision, and how has that impacted other developmental, emotional issues that come along with, being confined with a mask for all this time?
Data show that across a broad range of social, behavioral, and emotional outcomes, allowing kids to attend school in person is of the utmost importance. Accordingly, the Biden administration has prioritized that in their COVID response plan. Now, mask wearing can be a crucial part of a layered prevention strategy to allow children to remain in school when the conditions of the pandemic merit it. And it has been shown to reduce closures of at least daycare centers. The data for schools are not yet available. NIMH and other institutes, including NICHD, continue to study the impacts of both the pandemic and mitigation strategies like mask wearing on social, cognitive, and emotional development. To date, there are no studies that reveal any significant harms of mask wearing, but they have shown significant harms of school closures. So we look forward to continuing that research and making sure that we know for sure the effects of mask wearing and other mitigation measures of the COVID pandemic on children, but so far we have not seen any adverse consequences of those particular ones.
Thank you. And then one of the tragic consequences of trying to manage COVID from the mental health side has been, the overdoses that we've had to contend with. I'd like you to comment particularly on fentanyl, and is there anything else that's cropped up is contributing to that, and the other three panelists as well. We've got about 2.5 minutes left.
For the
okay.
There are two elements that are contributing. One of them is the social isolation and the uncertainty as stress has increased the risk of people to take drugs, and those are more likely to be exposed to synthetic drugs like fentanyl and others. And the second crucial element is, since the pandemic, the seizures of fentanyl has been increasing quite dramatically, making it very available. And also, as I mentioned before, it is increasingly used to contaminate other drugs. So those two elements, people being more vulnerable to taking drugs, while at the same time access to extremely dangerous drugs in the illicit drug market.
I certainly defer to Dr. Volkov on the fentanyl question. On the other, as an agency that focuses on maternal and child health, we just reinforce Dr. Gordon's point about the critical importance of children being in school. We have seen, because we serve underserved communities, how important it is for children to be in school to receive a series of services, whether those are healthcare services or whether that is key nutritional support and the like. And in order to do that, we want to make sure that children are following the appropriate public health mitigation guidance and responding to that as CDC continues to update that.
Yeah, and I'll just add that, in terms of the fentanyl, because of the patterns and trends that we're seeing, it's just increasingly more important that we have naloxone disseminated far and wide. So again, through our state opioid response grant, as well as block grant dollars even, states and communities can purchase naloxone to help reverse overdoses.
Very good, and I think it's sad that most of it gets produced somewhere else, comes through the southern border, and I think fixing that source would make a job a lot easier for all of you that have to contend with it. So I just hope that we get our hands around it to stop it at its source, and that looks like it's still to be accomplished. So keep up, in the meantime, all the good work to try to remediate it. Thank you.
Yes, Senator Rosen.